You know the old saying, if it ain't broke, don't fix it. Well, that is not exactly the best approach to handling your Medicare coverage. Every year, plans change, especially when it comes to prescription drugs. So our friends at Safe Harbor Retirement Group helping you wade through some of this confusion. And Safe Harbor President Cory Sickles joining me once again. And Cory, as a retirement planning business, I imagine healthcare has to factor into that, right?
Healthcare is a big part of it. I mean, one of the things that we try to do is we want to be able to provide our clients with an overall retirement plan, and healthcare is part of that. So, starting tomorrow, October 15th through December 7th, is annual enrollment for Medicare, and we offer Medicare services, for our clients as well.
And this is a time for people to not only change, but reevaluate. And you talk about like all of the things that could change year to year to year when it comes to, right, retirement and adding in that healthcare expense.
That's correct. Now, if you're on Medicare today, most people have probably already received, the new plan or the new changes in the mail. So it's going to talk about your co-pays or how much you're charging. But the one thing that it really doesn't do is really show you, are you in your best plan for the, for 2021?
So let me ask this, and it may seem like an obvious question, but if a plan has Ohio Health in their network and your doctor is with Ohio Health, does that mean you will automatically be covered in that plan? I mean, there's some kind of, I think, little things that people need to think about that may seem obvious.
You would think so, but really the correct answer to that is no. I mean, even though you might be covered by Ohio Health, your doctor might not actually be within that. And then the other part to think about is as you age and you're going through retirement, you might be adding more doctors as well, just for the fact that different health, things pop up, which means you want to make sure that your doctors will be covered in your current plan for 2021.
Especially if you have one you've been with, for a long time and you want to try to keep that specific doctor, I know. Another big concern people have is prescription coverage. People can, I would say, be taken by great surprise if they don't do their research there. That's
correct. Formulary change, they change every year. But one of the things you need to make sure of is that you're in your best drug program. So even though you might be on a program that actually all your drugs are covered, however, they can change from tier 1 to tier 2 to tier 3 every year. So you want to make sure that you have the best cost. And if you don't go through a process of having, someone like us analyze your prescription plans, you could be, paying hundreds of dollars of more than what you should be. The other thing that I think a lot of people need to take a look at for 2021 is now if you're diabetic and you're taking insulin, they have a new program out there where your copay might only be $35. However, not every program participates in it, and not every insulin is actually going to be covered. So one of the things, again, you want to be able to look at is working with someone like us where we can sit down to make sure that you're in your best prescription plan possible for 2021. And you should review that every single year.
So, Cory, say you're working with a Medicare agent outside of yourself. Are there things that people should keep in mind that maybe then when they bring it to you and say, hey, you're my retirement planner, here's the plan I think I'm going to be in, that they should maybe ask about that we haven't chatted about?
There's two things. One, is my doctor going to be covered? And the second part is am I getting the best possible deal on my prescriptions? Now, we definitely want to be able to look at that. But the other thing you also want to be able to look at, too, is, we want to make sure your doctor is going to be covered. But you might be able to go into a different program with some additional benefits or, possible lower costs. And what I mean, additional benefit might be you might be able to get a better vision plan, or you might be able to get, better hearing aids might be, so you might want to be able to make sure that you're getting the best deal on your hearing aids if that's out there, or if that's a need as well. So it's always good to be able to review all that type of stuff to make sure that you're in the best plan for you, because some agents out there only represent a couple different companies, where at Safe Harbor, we're independent. We have access to all the different types of insurance carriers out there. So we're going to find the best fit for you, not the best, fit for the only the programs that an agent might offer.
Right, and that is big, and the service is free if you're working with a Safe Harbor Medicare specialist. So we want to note that. SafeHarborOH.com. Cory and your team will help you through it all. So, Cory, thank you again.
Thank you, Robin.